the U.S. Census, 48% are limited English proficient. And we suspect that these numbers are underreported, especially when we're talking about elderly Chinese. A lot of people don't know that they have a right to interpretation services, but under Title VI of the Civil Rights Act, it prohibits discrimination because of national origins, and you could interpret national origins to include language rights. And what that means is that if you go to a federally funded healthcare facility, you could ask for interpretation services, or if you need to have any documents translated, and it should be provided to you in a timely manner. And you don't have to pay for this service. That would be hospitals, that would be health plans, HMOs, your managed care plans, your labs, or pharmacies. Well, they need to request an interpreter from their healthcare provider. So that would be, calling their doctor's office to request that interpreter. You could also request an interpreter from your healthcare plan, your HMO, your managed care. If you need help in requesting an interpreter, you could call Pals for Health, and we could request an interpreter for you. And we could also assist you by giving you a tool, which is called our ISP card. It's basically a language identification card that you could use and take to your doctor, so it could help them identify the language that you speak. Okay, so the pluses and minuses of having a friend or family interpret for you. The pluses are that you're comfortable with that person, and in most cases, it's convenience. The minuses of having a friend or family is that they don't have the proficiency a lot of times. They don't have the proficiency in English, and in this case, in Chinese. They also probably lack the medical terminology that's necessary when you're interpreting in healthcare. And most times it's also inappropriate, embarrassing, and also places a burden on that family member, especially if you're using children to interpret for you. We screen and test our interpreters to make sure that they're qualified to interpret in the healthcare arena. We have a comprehensive exam, and it assesses their medical terminology, the oral interpretation, and their translation. We also put them through a 48-hour training, and that will teach them their interpreting skills and also professional boundaries. The impact of having an interpreter, in most cases, it's a positive impact. We actually did a survey at PALS looking at, the health and well-being of our patients, and we found that almost all of them said that having an interpreter had a positive impact. They said that they're able to give an accurate account of their medical history, they're able to better understand how to take care of themselves, able to ask questions, and they actually have, have the doctor there for a longer period of time. It also has a positive impact, I think, on the healthcare provider, because they eliminate a lot of unnecessary tests, because they're able to communicate with their patients instead of having to run these tests. And it also decreases the malpractice lawsuit risk that they have.